Joining us in our studio here in Lagos is Dr. Richardson Ajayi. He is the Chairman, Governing Board, LASUTH, Executive Vice Chairman, Bridge Clinic, Sync Lab, Nigeria. He joins us here. Thank you for joining us on the program.
Thank you, Ajayi.
So a lot of people have been talking about the recoveries in Lagos, and we hear that over 10,000 is linked to the home care management. What's your perhaps assessment of the home care model by the state government?
Thank you very much for this question. I think we need to just gain an understanding of COVID as an infection. The people that succumb to this condition are usually the elderly and people with comorbidities, and that has been consistent across all countries. So what that tells us is that a lot of the people that get infected will be fine. So I think the fact that you have COVID doesn't mean you have a death sentence. And I think because most will be fine and will recover, and they need to be supported through that recovery, I think the idea of managing people at home is a very good one. In fact, if you look at the infection rate, when you look at the number of people that have been tested versus the number detected, it's about 15% nationally. Admittedly, our criteria for testing are quite stringent. So if you try and extrapolate that to the population and say, even if we use 5% for the population of Lagos, we probably have about 1 million people infected, but they're fine. So I think the idea of managing people at home, I think it's a right decision, and it's working very well.
So you have managed a COVID-19 isolation and treatment center. This is to support Lagos State's response. What was the experience like?
I think it was an important thing for us to do. I think sort of late February, a lot of us got talking that this thing is coming. What are we going to do? And we knew that the state had already set up the EOC at that time, and we knew there was talk about setting up isolation centers. IDH was being, uplifted, and we felt that Ethiopia needed something, because Ethiopia would be perhaps the epicenter, because a lot of people will be traveling back for Easter. And so we got together and felt that the private sector needed to do something. So the organization I worked with is an organization called YPO, Young Presidents Organization. And quite a few people in YPO, could muster resources. And so we decided to approach the state government and put our ideas on the table, and we were well received. We had to build the isolation center to specifications of pharma and leukemia, and assign an MOU with Lagos State to run the isolation center for 3 months according to all protocols of Lagos State. And we set it up. Mr. Governor opened it, and over the 3 months, I think we treated about 320 patients who were admitted in. And it was a fully equipped hospital. We had ICU beds, and we had about 130 staff that we recruited, and it was wholly run and supported by the private sector. The experience was, we felt it was needed. Throughout that period, my phone didn't stop ringing. People wanting to be admitted, people wanting to get tested, and we were very busy. But we closed the facility end of July, which was the plan. And having done that, I think we filled a significant gap in the need. So it was a very, very, it was a good thing to do, very beneficial.
We also understand that there were some deaths that were recorded in the facility. Perhaps you tell us a bit more about that, but we need to go on a break now. We still have Dr. Ajayi with us, and more when we return. Stay with us. Welcome back. We still have Dr. Richardson Ajayi, Chairman, Governing Board, LASUTH, Executive Vice Chairman, Bridge Clinic and Sync Lab, Nigeria. Talking about the isolation center in Ethiopia, which you said that is closed at the moment. There were some complications due to that led to some COVID-19 deaths. What were the problems?
Well, we had 6 deaths in the isolation center out of about the 320-something patients we admitted. All had comorbidities. The 3 leading issues: one is the age, second is diabetes, third heart disease, and I think one of them had renal complications as well. So I think it's not just having COVID; it's having COVID and something else that's quite advanced. So we lost six of the patients very sadly, but we gave them all that we could.
So there were no issues with regards to ventilators, the oxygen, all
Oh,
the other
no,
provisions?
we were fully equipped. We were fully equipped. We had 4 intensivists on the staff who are experienced ICU doctors. So we had everything in place to ensure that we would meet the needs of anybody.
What's your take on the Lagos numbers, the trend, the trajectory of the virus in Lagos, and to see that it's also sort of opening up? If you look at other countries, a number of them have opened up, but they're closing back down, locking back down due to spiking cases. Is it too soon? Are we moving too fast, or do you think this is okay?
Well, I think first thing is to just say I would doff my hat to Mr. Governor, our Incident Commander, and the Honorable Commissioner for Health, Professor Ajayi. In the approach, I mean, they've been very, very strategic in terms of decision making. We were locked down at the right time because we didn't know what we were dealing with. But you have to balance that with the fact that most of the people in Lagos need to earn an income. And I think they made the right decision to open at the right time. And we've been looking at the trajectory. And over the last, if you take a broad view of the number of new cases, it's tailing downwards. The hope is that it's not the calm before the storm, but it looks like, things have been managed. And our ship of Lagos has been charted through a very turbulent sea. And I think we were dealing with something really, really, really difficult to manage. But I think they've been very tactical and strategic in decision making. And I think it's getting calmer. And I hope we don't get another spike.
All right, lots of optimism from you. Thank you so much, Dr. Richardson Ajayi. Thank you for joining us on the program.
Thank you for inviting me.